Hi, welcome to this section of cardiology. This is Dr. Jaitly. In this particular video vignette, I'll be talking to you about what is peripheral vascular disease, or PAD. Now, these are the arteries that are branching off from the aorta, and they are either within the head, obviously, so they are the intracerebral and carotid arteries. Then, as the aorta arches through the thorax and goes to the abdominal area, then obviously the arteries going to the stomach or to the kidneys become the peripheral arteries. And then the aorta divides into the femoral arteries in the legs, and then down into further branches in the distal lower extremities. So arteries in the peripheral vascular tree, like the lower limbs, the head, the kidneys, the stomach, when they develop plaque formation, it's called peripheral vascular disease. Now we know plaques, like on this left panel I'm showing you, the plaques normally start very early on in the age of the second decade, perhaps, depending upon what one's diet is, what the family history is, what the cholesterol is there a history of smoking. All these are risk factors. Is there a history of hypertension? Is there a history of diabetes? So all of those risk factors, they really cumulatively help develop plaque, if you will, and make it progress at a certain age. Now, the more the risk factors, obviously, it's going to be progressive early on. Smoking is one of the biggest risk factors, and obviously it's the most modifiable factor. If somebody quits smoking, then one can really reduce the incidence of peripheral vascular disease, which may be either a stroke or a kidney infarct or a heart attack, or even the lower extremity issues like gangrene and somebody losing a limb and eventually requiring an amputation. So peripheral vascular disease is a very high prevalence in certain condition groups, specifically the diabetes, the hypertension, and the people who have high cholesterol. But never underestimate the fact that the biggest risk factor is still smoking. One other thing I always like to point out is plaques normally are very rich in fatty materials, specifically the LDL cholesterol, and they have a mix of fibrin, calcium, and fibrous tissue here. So sometimes these plaques could be vulnerable and they can break open. And when they break open, it's called the rupture of a plaque, and there is an acute thrombus or a clot that can form that can compromise an intraluminal opening from here to something looking like this. That means you could have a drop in the flow within the artery rather abruptly, and that could lead one to develop an acute event, which could be either in the head. It may manifest as a stroke. It may be in the heart, manifest as a heart attack. It can manifest in the kidneys as a kidney infarct, or in the lower extremities, it could manifest as an acute loss of limb circulation. So sometimes these things could be very, very abrupt in onset, and at that point it is an emergency. But plaques in general are chronic plaques, and the peripheral vascular disease is a huge entity that should be examined, because atherosclerosis is not sparing any arterial group. We know it's a systemic disease, and when the atherosclerosis or the plaque formation begins, it not necessarily is only implying the head or the heart, but it also implies the arteries elsewhere throughout the body. So that was a point of discussion in this video. I just wanted to bring that point out, that PAD is not to be forgotten, because peripherally you can involve all the vital organs from head to toe, and arterial groups which are involved have plaques in them, and the plaques are critically important or significant. Then one can really have obstruction to the flow, and as a result, patients will manifest with all the symptoms. And we'll discuss individual arterial groups at a later time. Thank you for your attention. I appreciate your time. Thank you so much.